Happy New Year, everybody. Welcome, welcome. Happy New Year, everybody. This is Dr. Magarelli, CNY Fertility, Colorado. Welcome. Welcome to 2022. How exciting. What I would recommend is for all you wonderful folks who want to listen in, jump over to Facebook Live, as well as, love the kisses, jump over to Facebook Live or YouTube Live. I'm going to be doing a talk on what's new in 2022. It's going to be exciting. Well, good morning, Hallie. Happy New Year. Excited to meet you soon. Hallie, good to see you. Thank you for being on Facebook. So everybody who's on Instagram, please jump over to our CNY Facebook Live or the YouTube Facebook Live. Hey, B Noble Jack, waiting for my BFP. That's great. Happy New Year, Serendipity. Everybody, Janice, Joni, thank you for jumping on. All you folks who are on Instagram, if you can, jump over to Facebook Live, as well as to YouTube Live. We are doing a talk today on what's new in 2022. I'm going to be talking over the next probably month or two all about some of the new stuff that's coming into 22 in the field of reproductive medicine. So if you're on Instagram, jump over to Facebook Live, and I'll speak for about 30 minutes. And then once I'm done that, we'll answer some questions. So we will not be continuing the live on Instagram. We will not. Will you not? Oh yeah, the Instagram live will be on, but it's better to so you can see the actual slide set, because I do a slide set for those folks who are on Instagram. Jump over to Facebook Live or YouTube Live. Unfortunately, the program we use, which is called StreamYard, does not stream live to Instagram, unfortunately. So if you're on Instagram, jump over. If you don't have Facebook, go to YouTube. Go to Serendipity Design YouTube. You can go to YouTube at CNY Live YouTube, so you can go there and see us live there. So what we'll be talking about now is, hello everybody, Carrie Jane, Coco Monahan. Jump over, everybody, to Facebook Live or YouTube Live. I'll be still streaming on Instagram so you can hear what I say, but you won't be able to see the slides, but I tend to read the slides. But it's much better if you... so the software that I use to stream is called StreamYard, and it only allows you to stream Facebook and YouTube. We can't stream Instagram. I'm sorry about that. And so if you guys can jump over, I'll give you guys a few minutes. All of you on Instagram, jump over to Facebook Live. Love to see you there. We're going to be talking about some really great stuff today. Actually, two very big topics we're going to be talking today. One is DuoStim, and the other is going to be on serovital or growth hormone secretagogues. Both of these we use a lot in our practice because it does improve reproductive outcomes. I have a long list of topics. So all of you folks who are on Instagram, jump over to either Facebook Live, CNY Facebook Live, CNY YouTube Live, and you can watch me stream there. Is Dr. Kiltz a part of our team at CNY? Spoke with him. Yes, of course. Of course. That's an interesting question. So all you folks who are on Instagram, jump over to Facebook Live or to YouTube Live. I still will be streaming on Instagram. You'll hear me, but you won't be able to see the slides I put together for 2022. Our discussion today is going to be on what's new in 2022. So without further ado, I'm going to start. Let's get this show on the road, as they say. So again, all you folks who are on Instagram, please jump over to Facebook Live or to YouTube Live, because you can see what I'm talking about. You can hear what I'm talking about on Instagram. But if you go to Facebook Live or YouTube Live, you'll actually see what I'm talking about. I'll talk for about 30. Okay, Joni, thanks for listening. I'll be talking for about 30 minutes, and then we'll jump over and just answer questions. So all you folks on Instagram, jump over to Facebook Live or YouTube Live, CNY, okay? Thanks for jumping on, everybody. I'm going to move over, start talking, and then periodically, if you guys who are currently on Instagram tell everybody else to jump over to Facebook Live, that'll be great. Okay, so these are some of the approaches I'm going to take for 2022 in discussing the insights into the emerging technology and techniques in reproductive medicine. So I'll always have three columns. One is what is our knowledge, what is our technology, and what is our techniques. Today in yellow, I've highlighted that I'm going to be speaking about the DuoStim IVF. And then I'm also, that's a knowledge thing. What's the basis for it? What do we know about it? The technology I'm going to talk about today is serum, vital, and growth hormones. So what we're going to do is divide and conquer, because there's a lot to cover. I tend to cover a lot of stuff. It's just my habit. So today we're going to talk about DuoStim, and we're going to talk about growth hormone secretagogues. Now, again, I'll say it one more time. You folks who are on Facebook, on Instagram, please go to Facebook Live or go to YouTube Live, and you'll be able to see all of the slides that I put together. You'll see a lot more. You'll still hear me talk about what I'm doing on Instagram, but you could see everything on Facebook Live or YouTube Live, the CNY. So let's start with DuoStim. So what is DuoStim? It was thought for many, many decades that that in humans we had one stimulation or follicular phase and one luteal phase. We ovulated once, we recruited the eggs once, had a whole bunch of eggs recruited, only a few of them made it to maturity. Of those, one or two would ovulate, and that's a normal cycle. And we knew, and we believed this, although we really didn't study this. And what we have now come to understand is that women, and this is something I found out very recently, can have either typically 2 or 3 waves of follicular recruitment during their typical 30-ish day cycle. Now, I'm not going to call it a menstrual cycle, although there is menstruation. So here's a nice image of a 28-day cycle right about here. And within those 28 days, we now know that we can, in IVF, stimulate females to produce mature follicles that are ovulatable and mature follicles that are able to be retrieved. So in a typical menstrual cycle, there are 2 waves of follicular recruitments. Follicles are the label for the structure that contains the oocyte. So these are antral follicles. They don't have and pre-antral follicles. These have an antrum. And then when it gets to this stage, you can see the oocyte and the granulosa cells. And finally, you ovulate your egg. So it turns out in humans, we can do this twice. Now, what was the impetus for us to even ask the question of whether or not we could get more than one group of follicles in a 28 days to grow and mature and get eggs? It was cancer therapy called Onco Fertility. This was designed to help couples who were limited in the amount of time that they could get eggs. And usually it was 30 days. That's all the oncologists would give us, or cancer doctors would give us, to get the eggs out before the woman had to do either extirpation surgery, remove the ovary, or get chemotherapy, which of course has a negative effect on the eggs themselves. And this was exciting because it allowed us to get what I'll show you, more eggs, more embryos, more blastocysts in a 30-day period than we ever expected from a single cycle. This DuoStim was expanded to those women with extreme ovarian reserve issues. So not only were this useful for patients who had a little bit of time, but it also was now thought to help those women who have very few eggs and are losing them rapidly. So to give you put it in perspective, typically the estimate of egg losses for women less than 35 is that a woman will lose 1,000 eggs every month. You can see these little follicles here. These are the follicles, right? They could lose about 1,000 of these every month prior to the age 35, but over age 35, women lose up to 10,000 of these. An enormous increase in the number of eggs that are lost. And so every month, a woman over 35, certainly over 40, would be losing 10,000 eggs. So the risk of having no eggs left, since a woman only has about 400,000 eggs available, was very risky. So it began to be applied, this DuoStim, or two-wave IVF, began to apply to women with extremely low ovarian reserve to a great success. And what we have found is that in women doing what we call DuoStim versus back-to-back, now back-to-back stimulation is you do one stimulation, get the eggs, you wait for a period, you do it, and so it's about a month, and then you go do another cycle. These are back-to-back cycles. Now, this works great for women who have lots of eggs, and it works really well for women less than 35 who have normal ovarian reserve. But what in this study and others have absolutely found is that if you have a patient who has a very limited time to achieve an egg that can be created to an embryo that can be frozen and used for embryo transfer, that DuoStim would get you more eggs, more embryos, and a much better chance of achieving a baby. So the reason I bring this up, and all you guys on Instagram, please jump over to Facebook and YouTube Live. I'm doing a lecture here today. So all you fine folks who are on Instagram, jump over to Facebook Live and to YouTube Live. And then I'm going to come back to just question and answers here shortly. And by the way, I'm Dr. Magarelli, CNY Fertility, Colorado. So what we have now found is that, well, here's the question. Is it better for young people to do a DuoStim or a back-to-back? Well, preliminary data shows that it's not better. It really doesn't improve your chances. It's a little more time consuming. It becomes more costly because typically, if you have normal ovarian reserve, you get more than adequate numbers of eggs per cycle. And the magic number is you want to get about 15 eggs per cycle. So not necessarily. The reason we do a DuoStim is to get you to an embryo quicker if you're limited by cancer or you're limited by ovarian reserve. So right now, I'm still doing a lot of homework on whether or not we can use this on everybody. I think the preliminary data says no, but it's just an area that I thought was of interest. You will see a lot more DuoStim this year, especially in patients with low ovarian reserve. Interestingly enough, what they have found is when you do a DuoStim, that means you stimulate, during the first 14 days, you do a retrieval, you either take 1 to 5 day break, then you do another stimulation. It turns out when you do that second stimulation, that's in the luteal phase of the menstrual cycle, and we actually get more eggs. I mean, significantly more eggs than in the first part of the cycle, which is kind of interesting. We think it might be the priming of the second phase with the estrogen from the first phase. A low ovarian reserve is a patient who has an AMH of less than 1, has done a previous IVF cycle with less than 3 or 4 eggs retrieved, and who failed to stimulate with the normal doses of medications. So there is an actual criteria called the Bologna criteria, and it does vary, but it's typically a low AMH of below 1, an IVF cycle or previous stimulation which didn't work and you didn't see any sort of a response, or very few follicles are recruited at the time of stimulation regardless of the medications. That's considered low ovarian reserve. We also, by definition, consider women over 40 with having low ovarian reserve just physiologically. All you folks who are on Instagram, please jump over to Facebook Live or CNY. Facebook Live, CNY Live, or YouTube Live, because we're doing a little lecture, and in about 15, 20 minutes, I'll be answering questions. There is an issue. Other studies have looked at the euploid rate of the embryos that were made either pre and post the DuoStim, and the consensus now is there really are more eggs, more embryos, but not necessarily more euploid embryos during the luteal phase versus the follicular phase stimulation. That was a question here. There's a nice review paper, 2 review papers that I was reviewing before I came on tonight. So the jury is out in terms of whether or not one part of the cycle has more euploid than the other. There's contradictions there. However, there is no doubt that by doing DuoStim, you end up with more eggs, more embryos, more blastocysts, and more euploid totally in a shorter period of time. The key is in a shorter period of time. Head-to-head comparisons, there's been a few, but they're using historical controls versus contemporary research. Those are not very good studies. There is a suggestion that the DuoStim is better than a back-to-back for these patients, specifically the low ovarian reserve patients. And I tend to agree that getting more eggs, more embryos quicker is better. So that was a very, very short overview. And again, I'm trying to get 2 topics in for each half hour. This one is a little bit longer. I was asked by patients, as well as by my staff, and as well as by the global staff, to talk about the question of growth hormone secretagogues. How does growth hormone help, and specifically, how does serovital work? So we're going to talk a little bit about growth hormone, what it is, how it's used in human physiology, the role in fertility, some of the products on the market, some other growth hormone augmenters, and then, of course, give you some conclusions here. So here's the deal. As we get older, the growth hormone in our bodies decline from age 10 to age 80. Here are levels. We have an approximate percent secretion rate of about 80% at 75. At 10 years of age, and then by the time you're 80 years of age, it's about 10% secretion. So you can see it's a dramatic reduction in the production of growth hormone. And of course, in a sense, because we are humans with a limited lifespan, that makes sense. We're not going to continue to grow. We grow and then we senesce, which means get older. Now, all you folks who are on Instagram, jump over to Facebook Live. I'm doing a little lecture, another 15, 20 minutes. Go to Facebook Live or YouTube Live, and you can watch this whole thing that we're talking about. So the location of the growth hormone is secreted from the pituitary gland, which is pretty close to where they do that COVID test here. If they stick a swab in your nose, it goes right back here to this part of the body. Right behind it, this is a sinus. Right behind it is the pituitary gland and the cella turcica here. And that is what secretes growth hormone. Now, there are many things that control the secretion of growth hormone. Everything from the foods you eat to drugs you take, etc. So there are a lot of regulators of growth hormone secretion, and growth hormone and insulin, like growth factors, have very similar characteristics. They help, for example, growth hormone increases metabolism of fat, increases growth of the bone, increases muscle mass. Ghrelin, which is the part of the eating cascade of a human, stimulates growth hormone. Exercise, and I'll show you some other things. But it's a peptide hormone, comes from the anterior pituitary, and it works on growing you postnatally, which means after birth, and increases your metabolism, and then grows various parts of the body. Now, here's a very interesting review study by Jovich and Stanger, which showed that by adding growth hormone to patients' cycles, and historically we've done it to low ovarian reserve patients. However, I'll show you that even in normal ovarian reserve patients, we're now seeing that there's a benefit to adding growth hormone. And you can see why, and I'll go back in a second, is because really, if you look at a patient who has a normal ovarian reserve in their 20s and a patient with low, you can see there's a loss, but there's a dramatic loss in growth hormone during that prior to that era in your life. And here you see on the top chart is the pregnancy rates in those patients who did an IVF cycle with and without growth hormone. And here you can see, this is a review from 2002 to 2006, that in all cases, the clinical pregnancy rates per transfer were dramatically improved by adding growth hormone. That's the gray here. In this one, it looks specifically at the number of transfers that were done during that same time. And you can find here here it's been flipped a little bit. So the light gray is the growth hormone here. The dark black is the the gray is that the number of transfers that were done continue to rise over these times, to give you an idea that more and more of these patients were doing growth hormone. And what they found was that they increased the number of eggs retrieved, increased the number of embryos available, improved the pregnancy outcomes, especially in patients with low ovarian reserve. And this is a key, it reduced the amount of costly gonadotropins and the total cost of the IVF cycle by adding growth hormone, and has been shown to improve the actual endometrium. Omnitrope, by the way, is the growth hormone medication brand name, Omnitrope. And as I said, in 2021, brand new study suggests that growth hormone helps even normal ovarian reserve patients. So it's basically it's a peptide that has many functions. In another study, they looked at the role of growth hormone on the endometrium. At CNY, we do washes with growth hormone. We do washes with PRP. We do washes with pregnancy hormone. And it would make sense that in this case, if you add growth hormone to a person who's had prior poor endometrial development, that you would have growth of that particular tissue. This red here, this is the uterus here, and this red area here is the actual endometrium. This is the myometrium. And so there's another possible role for growth hormone, both given systemically as well as locally. Growth hormone plays a crucial role in growth, but the nutritional status of our bodies determines how well or how much growth hormone is secreted or inhibited. So, for example, somatostatin inhibits growth hormone. And I'm going to talk a little bit about how somatostatin and Cerebral work. And insulin-like growth factors are produced by the liver, and they're used in both skeletal muscle development, bone growth, as a regulator of a negative feedback loop to the pituitary. And in this particular study, they talk about the microbiota and how it influences growth hormone secretion. So growth hormone and insulin-like growth factor play a crucial role in the regulation of growth and an anabolic or a building effect of the intestines, and it stimulates the catabolism or breakdown of fat as well as bone growth. The effects of growth hormone occurs independently or in synergy, so they work together or separately. Interestingly, circulating levels of IGF depend on the nutritional status of the organism. Think Cerebral, because we're going to be talking about Cerebral here shortly. So another interesting thing I thought is that at CNY, we also do PRP. Platelet-rich plasma injections into soft tissues have been shown to improve the soft tissue. So we now do PRP injections, which creates a growth factor response. It's a growth factor in the ovary hopefully for improved vascularity, therefore more access to eggs, and in the endometrium for improved vascularity to allow for the lining to grow better. So that's just an aside. Now, what is Cerebral? We talk a lot about that on my lives here. People ask me, what can I do to improve my IVF outcomes? So the answer is, what we can do is, I apologize. My thing is going crazy here. All righty. What we can do is take this amino acid complex, and I'm going to go over what it is. And what it does is it improves our own body's production of growth hormone. Of course, growth hormone is very expensive. And it does it through the action of amino acids and other products. So this is Cerebral. It's available at Costco. It's about $70 for a 40-day supply, which is probably the least expensive way to get access to a growth hormone inducing product. And so these are a few of the studies. In one of the studies, they looked at the improvement in insulin-like growth factor as a result of using this amino acid supplement, and they found that in 24 weeks, it improved IGF-1, which I said works in synergy as a growth hormone, and it was associated with weight loss and improvements in the cardiometabolic markers and clinical symptoms. So this is more general. In their original studies, what they did was they looked at adding Cerebral to a group of folks. I think the average age was about 38. So in that sort of low ovarian reserve group, and they found a 682% eightfold improvement from the baseline in growth hormone secretion in the body. This was the thought behind using growth hormone for using Cerebral for our patients, because in this way we can enhance the amount of endogenous growth hormone, that's what's produced by the body, as well as we can give it exogenously, and studies have definitively shown that this improves pregnancy rates, reduces miscarriage rates, improves live birth rates in patients as growth hormone, exogenously given outside. But why not use the stuff that's inside? It's much less expensive. So here's that original study, and you can see that in those patients who were given this product, after about 60 minutes, those who had the product, which was the true product, at that time it was called Protovale, it's now Cerebral, you saw this 600% improvement, whereas those who were given a placebo, there was no effect. So it led us to suggest that by adding Cerebral, which is relatively inexpensive, to all patients, as well as males, by the way, can be helped by this. We propose that we would see a positive effect. Now, how does it work? Well, what it does is it inhibits somatostatin, and somatostatin stops the pituitary from secreting growth hormone. So if you inhibit somatostatin, and here are some arginine is an amino acid, serotonin is a neurotransmitter. You would be able to, if you could stop the somatostatin from being secreted, right? Because arginine, acetylcholine, ghrelin have a negative effect on somatostatin secretion. This would cause your own body to secrete more growth hormone because you got rid of the inhibitor. Okay? So what they proposed was that by adding this group of amino acids, lysine, arginine, oxoproline, N-acetylcysteine, glutamine, and some other parts, herbs, that they would be able to increase the body's growth hormone, and they were able to do it. They did another study, and they found that physical fitness and sleep efficiency were improved. And all of that, of course, a healthy body is a fertile body, would contribute to a better reproductive outcome. Now, not only is Cerebral a source of a way in which to improve the growth hormone in the body, and it's sort of packaged together, but also, there are a variety of macro and micronutrition components that can help improve the amount of growth hormone that's secreted. Here's a list of amino acids. In red are the two that are found in Cerebral, but you can see that a high protein, a high protein diet, which means those that access these amino acids, both essential and non-essential, will improve the amount of growth hormone that the body secretes. Now, there are other things that also can improve growth hormone. Just to give you an idea why it works, why the oxyprolone, which is a proline, which is a compound found in Cerebral, helps. Well, it actually helps to transport the neutral amino acids into the brain. And of course, it's in the area of the brain that the growth hormone is produced and secreted. Now, in a study by myself and Dr. Credenda, we did a study looking at adding acupuncture to a growth hormone supplemented IVF cycle. And what we found was about a 12% improvement in ongoing pregnancies in those patients who receive the growth hormone plus acupuncture. Now, this is not a discussion on the role of acupuncture, but again, it just suggests that at CNY, we try to synergize with different types of integrated medicine, nutraceuticals, understanding how things work. My background is a nutritional biochemist. I did decades of research in the area of marine animal reproduction, especially with regards to nutrition. So we pull all these resources together to give you guys a really good chance of success. Now, another acupuncture is great for egg freezing. Okay. Well, acupuncture is great for a lot of things. Another thing that you can do, and you know that Dr. Kiltz is a big proponent of intermittent feasting, which he calls, which is real intermittent fasting, meaning you eat maybe one meal a day. It turns out that growth hormone is augmented in its secretion when you fast. So why does that make sense? Well, the more growth hormone you secrete, the more you break down fat. And if you're fasting, your body's hungry, and a great source of energy is the fats in your body. So fasting can also help with improvements in growth hormone. So what do we conclude? That any substance that enhances growth hormone secretion in men and women attempting conception should, because the studies haven't been done. Hi, the journey through IVF. Good to see you. Anything that increases growth hormone secretion or the addition of growth hormone should improve reproductive outcomes. Many nutraceuticals, amino acids, vitamin C, believe it or not, is another. Lifestyle changes like fasting, acupuncture can improve growth hormone secretion. Now, Cerebral is a proprietary combination of nutrients and other substances, and it's been shown to improve growth hormone secretion by as much as over 600%. It fits in our CNY family of add-ons, giving its low cost. It's only about $70 for a 4-day supply, and it has documented efficacy. And things like fasting, which is another very cost-saving lifestyle change, or eating fewer meals, has been shown to improve growth hormone secretion. So this too is a CNY lifestyle add-on. So in doing this talk today, I'm starting a sort of thought experiment for everybody to start thinking about areas of medicine that are changing in the reproductive field and how it can help in terms of getting you aware of your options, making you better understand why we do the things we do. And here's a question. Can you describe the difference in growth hormone priming versus supplementing only during Stims? This is Cat Isa Ninja. Well, Cat is a ninja. That's a great, I just got that. That's great. Yes, Cerebral is suitable for everybody. So I'm going to start taking questions. Let me get my pretty face on here. You can see the other topics over here. Let me get down here on the other screen. Okay, so you're welcome, Amanda. So can you describe the difference between HGH priming? The word priming is important. Priming means in preparation for a cycle. So you prime the pump to get the water to flow. You prime the carburetor to get the car to move. You prime the ovaries to give us eggs. So in a lot of studies with growth hormone, they do recommend, or low ovarian reserve patients especially, that you prime with estrogen the cycle before, or at least 7 to 10 days before, to synchronize the follicles as well as to enhance angiogenesis, which means blood flow. So if you prime with growth hormone the previous cycle, so let's say 6 weeks, you are then feeding a larger cohort of eggs that are it takes 3 months for the eggs to get stimulatable to come out. you are priming all of the blood vessels as well as growth factors in that group. So the longer you prime with HGH, theoretically, the better the outcome. But all of the studies on growth hormone were really done for 14 days or 21 days or 12 days. And so another option, of course, is you can do the priming during, or you can do the supplementing with growth hormone during your cycle. It really depends. Now, we're very cognizant of the fact that growth hormone itself is very expensive and it's an injection. However, with Cerebral being as inexpensively as it is, even if you don't know if you're going to do IVF for 3 months, 6 months, 9 months, I take the Cerebral every day, and I've been doing it for years. And I'm 95 years old, and not too bad for 95. Just kidding. Utilizing Cerebral for a longer period of time is, of course, going to improve your own body's growth hormone, which in turn, of course, is going to help. So I hope I answered your question. Okay, can you repeat requirements for DuoStim? Well, the DuoStim are for patients who have cancer, in other words, and have only 30 days to get all their eggs out, or for patients with extremely low ovarian reserve who can't afford to wait months for care. So the typical DuoStim, you get 2 retrievals in 35 days. In a normal back-to-back cycle, you get 2 retrievals in about 90 days. So you can see that more quickly, if you have very few eggs and you're losing 10,000 eggs a month, it's probably better to get 2 retrievals in 30 days. Is the procedure easier if you don't have tubes? No, it doesn't matter. If you have PCOS and also have a tumor on your pituitary gland, are there meds for it? Can you take Cerebral? Yes, you can take Cerebral because there's no really contraindication there. And are there meds? If the tumor is a prolactinoma, you could take medicine to reduce that. I've seen huge differences in dose. Cost aside, is there a thought on optimal dose of HGH during Stims? Well, most of the literature says 4 international units a day to 6 international units a day. Some people think more is better, but I think the studies have shown that the 4 international units a day or 6 international units a day or even 2 international units a day seem to help. If the protocol is Omnitrope and LDN for 30-day priming, should you stop Cerebral? No, never stop Cerebral. They're not connected. They continue with the Cerebral. What causes low fertilization? Used ICSI and Zymot. Typically chromosomal problems with the sperm. Do studies support taking Cerebral while pregnant? There are no studies as far as I know. However, the components of Cerebral are strictly amino acids and supplements. So they're as you know, the FDA always says supplements it's considered a supplement. I take NAC. Should I discontinue that if I start Cerebral? I have no idea, Helen, because there's been no studies. But I don't see why. Can I start Stim cycle the same day of my consultation if we didn't know? You cannot, Scorpio. It takes 2 weeks after your initial consultation to talk to financial. Then once you talk to financial, you talk to your nurse team. The nurse team then reviews all your records. That takes 4 to 6 weeks. And then you can be considered to start a cycle. There was another question, but I lost it. So would you say it's safe to take Cerebral during pregnancy? I don't have any data. I don't see a reason why it wouldn't be, but I certainly don't. I'm a data-driven guy. I don't see a mechanism by which it could hurt. I just don't see a mechanism by which it hurt, and I don't think on the box itself there's any precautions. Does Cerebral help with blood clotting? No. I have PCOS. Should I take Metformin? And that would be the dose. My MSH is what? And what would be the dose? I'm not a big Metformin is a expensive way to do keto. Metformin tries. We were actually talking about this today. Metformin is a glucophage. It eats glucose. Well, it eats glucose because you're eating too many carbs. or that's the problem it's trying to treat. Actually, in studies that I've done, I've seen significant reductions in hemoglobin A1C, which is sugar in the blood, by reducing the amount of carbohydrates in your diet to less than 75 grams per day. And it doesn't have the side effects of metformin. And metformin is a very good drug, but it has a lot of harsh effects. A lot of harsh effects on the liver. Do you recommend continuing acupuncture during pregnancy? Absolutely. There's many, many, many studies looking at miscarriage rates being reduced by adding acupuncture. Do you recommend DuoStim with people 43 or over? Yes. Yes, I strongly recommend it, especially after this review. Do you require a current HSG for all patients, or is there an option to opt out? We do require some sort of uterine evaluation. And by current, you mean within a year. If you've done an HSG within a year, the reason it's not a matter of requiring, the reason you want to make sure that your uterus is normal is because you can go through all this wonderful work, and then it turns out that you had a polyp. And the older you are, the more likely you have a polyp or a fibroid. Do you recommend DuoStim? Sorry, I already answered that. Can you stop progesterone after transfer and you're pregnant? No, you do not want to do that, Tasha, until you're at least 10 weeks. I read research and it looked like it left the jury out on L-arginine's efficacy and safety. Whoop, I lost that one. Do you recommend a diet of only meat to achieve? No. Meat and above the ground green crunchy vegetables like broccoli and celery, and as my grandson says, cauliflower is scared broccoli, snap peas, Brussels sprouts, green crunchy vegetables, good fatty meats. Is there anything I can do to prevent a miscarriage? I'm 9 weeks and have COVID. Well, I hope you got the vaccine. And my understanding is as soon as your symptoms go from COVID, you can get the vaccine. I think I said 5 days or 10 days after. Where do the ingredients in Cerebral come from? Just curious if it's from stem cell. No. I've been on it for 6 weeks. No. It's these are just formulated. One's an herb, and the others are simply amino acids. They're not from stem cells or anything like that in Cerebral. So what you can do, Alyssa, is to reduce miscarriage rates is traditional Chinese medicine in the form of acupuncture, keeping yourself well hydrated, making yourself preventing yourself from becoming dehydrated. And I don't know how far along you are. You're 9 weeks. You can continue with the baby aspirin if you're on it already. Okay. What else do we have here? I'm almost 41 with an AMH of 5. Would DuoStim be appropriate? I've done 3 cycles with 2230. No, Helen. You seem to be able to get eggs very quickly. And now it seems like you've done 3 cycles and have not been successful. I would add, I wouldn't do DuoStim, but I would definitely add growth hormone and Cerebral. How soon after a frozen embryo transfer can one get the booster? I say we're all suggesting a month, okay, if you're pregnant. If you're not pregnant, of course, after your blood test. I was told at baseline for my ERA cycle that I have an 18 millimeter fibroid. Does that need to be removed? Only if it's interfering with the inside of their uterus. Should I add a hysteroscopy to my ERA? Yes. At CNY Colorado, yes. Especially if, or go straight to removal if needed. Well, first find out if it's needed. I looked up Cerebral and there's a couple of them. Do not do the advanced Cerebral. It has caffeine. So do not do the Cerebral advanced. That's more of a stimulant. Do not do the basic Cerebral. Should I get a booster prior to transfer? That would be fantastic, Tori. Yes, because you're not pregnant. The first month, we're not sure about getting any kind of a vaccine and during the first month of gestation. So if you can get it before you get your transfer, fantastic. A low testosterone reversible to increase sperm count. Yes, Ashley, it's not reversible, but there are medications to help it. Do not use Clomid. Do not use testosterone to increase your testosterone level in the male because it causes sterility. What do you suggest immune suppressant protocol for transfer fauna? Well, that depends on your history. Cat is a ninja. I love that. How do we coordinate a DuoStim with CNY? I'm just starting a follicular retrieval. Should I schedule a consult now to discuss? Absolutely. See if you can jump on my schedule. See if you can do that. Monica, I'm 48, low AMH, 2 failed cycles, donor eggs. What do you recommend? 2 failed cycles. Well, don't worry about, I'm assuming you're using donor eggs, so don't worry about your low AMH. You need an ERA. You need your uterus evaluated, acupuncture. Make sure your nutrition is sound, low carb eating. How many weeks prior to FET is it safe to get a booster? As I said before, 4 to 6 weeks is probably reasonable. No. Be prior to an FET. Probably. I don't know I don't have an answer, but I would think that 2 to 3 weeks would be fine. I did acupuncture prior to my InvoCell cycle. Now I'm pregnant. Congratulations. Should I continue acupuncture? Yes, absolutely. Do you do virtual consults? Yeah, absolutely. Is there an age limit to use one's own eggs? No, there's an egg limit, not an age limit. If you got eggs, we'll use them. You're welcome, Helen. Maria, I'm 42, had 416 eggs retrieved with 3 cycle, 416. After PRP, I now have 15 follicles growing at a similar rate. Can I do a DuoStim? Absolutely, Maria. How do you recommend lowering FSH? You can't lower FSH because it's a gas gauge. It tells you how many eggs are left inside your body. So you can't gain eggs, right? No way to gain eggs. So the best thing to do is the Cerebral, the growth hormone, to make the eggs you have better. Can I prime with Omni and Cerebral, Omnitrope? Absolutely. And how many times a week should I do Omni? Well, it's a matter, Evelyn, of dosing. You should be doing like 4 units a day. Yeah. Okay. I hope you guys are still there. With high natural killer cells during pregnancy, do you have to do intralipids weekly, or can they be done every other week and or once a month instead? No ID, Marlena. I don't think there's any studies. What is the first step to book a consult? Just contact CNY Fertility. Go to the website, book an appointment. CNYfertility.com. I'm 28 years old, 2 failed embryo transfers, have 2 3-day 1/6 embryos on ice. Have you ever seen 1/6 embryos turn into live births? Any embryo can turn into a live birth. I don't use the grading system. Melissa, 42 years old, 2 failed IUIs, 2 failed IVF, 1 with donor eggs at another clinic. How easy is it to transfer your clinic? And it's easy to. And will the success rate be the same? Your success rate has nothing to do with the clinic. It has to do with you. You can't hear me. I have to get out of this, and I'll come back, guys. One second, folks. Sorry. Anybody who calls me on my phone disrupts my iPad, which means I can't get into the Instagram here. I apologize, guys, on Instagram. It was a phone call that came through. Okay, I have my baseline today. Hello, everybody. Welcome back. Good news, I have 17 follicles. Bad news is I have a lead at 11. That's not a lead. Folks, the follicles don't matter if they're below 14 millimeters, okay? On a lot of times, I'm going to do a whole talk on what is a baseline ultrasound, and 11 is not a lead, okay? That's not a lead. Do you recommend transferring abnormal embryos? I do not recommend doing anything abnormal. Can they eventually become viable? They can't eventually become viable, or they may have been misread as abnormal. So that's a hard decision. That's a personal decision. Thanks, guys. I'm sorry about the the Instagram going down there for a second. I'm 35 years old, low AMH. Do you think priming with Cerebral is? Yes, it's great. Yes, continue on your Cerebral. As soon as you hear my talk, start Cerebral tomorrow if you're trying to get pregnant. I don't care what age you are, male or female. In my mind, growth hormone is a big component of health and wellness. We all age, but there's ways to mitigate some of that aging, and I think it's worth it. How long should I use Omnitrope? Recommend after miscarriage? Don't know the question, sorry. I did acupuncture, ERA, HCG, all the above. Should I try my own eggs? I have 6 kids. My husband has none. I passed all my physicals, so I'm at a loss and I'm getting older. Monica, I don't know how old you are. Start what tomorrow? Cerebral. My Embryo is also the best grade. I've lost you guys on Instagram there. I apologize. Do you have any programs for the medication payment plans? My understanding is we do not. But there are many programs out on the internet, the various compassionate care programs. So I would definitely go to our website. We have a whole series of grants and things like that. 48, should you use your own eggs? My recommendation would be to use a donor egg, but we certainly will help you, Monica, if that's what you want to do. How do you feel about donor eggs? I feel good about donor eggs. Let's say 11 millimeter isn't a lead, but I won't have my first monitoring appointment until Monday of next week. Do I need to worry about not starting an antagonist sooner with the one follicle starting at 11? That one follicle starting at 11 should not affect when you start your antagonist. But they will monitor you. They will absolutely monitor you. But if your baseline is today, how could you start next Monday? That's a week away. I don't understand what you're doing. You may want to get a consult. Oh, good, Amanda. I look forward to seeing you too. After priming, of course. What's the typical success rate for blastocysts using donor eggs? Each donor egg typically has about between a 40 and 60% chance of implantation. So that's the number. I'm 35 years old with unexplained infertility. I had one miscarriage about 1.5 years ago and failed IUI. Do you recommend I continue to try the IUI process? One, I failed IUI with letrozole. Well, if the question I have is how many IUI cycles have you done? Hi, everybody. IVF, pretty much I'm a strong proponent of using IVF after the age of 35 because at age 35, there's a dramatic reduction in the amount of available eggs. Okay. Sorry, I just recently turned in. What is Omni? Omni is Omnitrope. It's a growth hormone. I'm currently taking Cerebral. Great. And my egg retrieval today with you. Ha! All right. Should I be doing Omni as well? I'll be 36 next month. Upcoming frozen in prep for an upcoming. Yes, start the Cerebral is good. Typically, we don't have to start growth hormone. I'm now thinking better that maybe growth hormone is good for everyone, but I don't know. I'm not quite there yet. I think the Cerebral is good. I did donor egg and 2 failed cycle. That's why I'm trying to see if maybe I should use my own eggs. No, the issue is the uterus, Monica. Rosin, I'm 42 years old. My new protocol is 150 of Menopur, 400 going left. What do you think about these doses? Will it fry my eggs? No such thing, Rosin. No such thing as frying your eggs from food. No. Cat is a ninja. Why don't you get a consult? You have a lot of information that you need, and I don't want to short shrift it. See if you can get a consult, okay? How long do my labs are good for before we have to do them over? Well, we like to have the labs within 1 year, okay? That's what we try to do. Lori, I purchased frozen eggs. I wanted to do PGT testing, but I'm told it's not a good idea to do this testing when you're using frozen eggs. But then I read something online that said it's best to do these testing with frozen eggs. Now I'm confused. I'm 52. This will be my first child. I am not a big proponent of using PGT in women in eggs that are from women who are less than 30. certainly less than 30, certainly in their 20s, and most donors are in their 20s. Now, if you want to get a specific sex, then you have to do PGT, and it's fine. Cat is a ninja. I'm already on medicines. Oh, so you're no, you're done. You're done. You're fine, Cat. It's you're fine. You're perfect. You can get if you're worried, Cat, then yes, see if you can get in on Friday for a monitoring. Absolutely. Please don't worry. How do we get on the consult cancellation list? My appointment is February 22nd. It's a nice date. Just simply call up and say, please put me on the cancellation list. Yeah, so Kat asks to get monitored on Friday. La, would you recommend IUI? It depends on how old you are and your history, whether the sperm is good, whether both tubes are open, whether the uterus is normal, whether you have normal hormones, whether there's any evidence of infection or disruption in the uterine lining, whether you have endometriosis, PCOS. Lots of things come into play as to whether you do an IUI or an IVF. Thank you, Amanda, for the answer there. I'm already on meds. Well, I'm glad you're on meds because I think you're good to go. Again, that 11 is not just, I know I had a conversation today. I'm going to be doing a whole talk. I'll probably do it next week. I'll add that to my list of what should you have on a baseline and what you worry about and what not to worry about. All righty, we're winding down. I am 41, unexplained infertility. Oops, slipped away. Victoria, I had a frozen transfer last month with a normal PGT tested embryo. It was the best graded embryo, but it failed. What can I do different? Acupuncture, Cerebral, growth hormone, PRP wash, HCG wash, keto or low carb. How do you feel about transferring 4AA embryo that is a low-level mosaic monosomy 3? How do I feel? The feeling is not a part of it. It's saying it has a lesser chance, but it's not saying it has no chance. So I would transfer it, a low-level mosaic, if it were me. I'm 29, no issues. Hubby has low count and some abnormal shaped sperm. Yeah, then try IUIs, La. Lori, thank you. Can you explain why you don't generally like this testing? Because the studies for PGTA prior to about 3 years ago all seemed to think it was the best thing since chopped liver. Well, it turns out that there's not, if you look at the pregnancy rates per retrieval, not per transfer, which means you get your eggs, you make your embryos, and by the time you put them all back, how many babies do you have? Well, it turns out that women less than 35 will have more babies if they didn't do PGT than if they did. Now, they'll get to a baby quicker if they did PGT, but not more babies. And women between 35 and 40 seem to get more babies if they did PGT. And then women over 40 did not seem to be benefited at all. So PGTAs get you there quicker, but not necessarily as many chances. And a long list of reasons about PGT, but that's my short answer. Successful FET after an ectopic. No one cares about the ectopic. It doesn't influence frozen embryo transfers. The ectopic is in a tube. The transfer is in the uterus. So honestly, there's no relationship between those two. 2 chemicals in the last 3 months. What should we do next? Well, find out why you're having recurrent losses. That's a whole workup. So ask to get a recurrent pregnancy loss workup. Start acupuncture. Start looking at diet things. Download our family building guide. That's what I would do. Where can I set up acupuncture before? Hold on here, folks. Where can I set up acupuncture before? Go to the website, www.aborm.org for acupuncture, trained acupuncturists, or if you're in New York, to go to the Healing Arts Centers at CNY, or www.aborm.org, and you will find a certified, trained acupuncturist in the field of reproductive medicine, and I've trained them all. What is secretory endometrial lining reported on ultrasound? Oh, that's the juicy part of the lining. It's secreting fluid into the cavity, which it should be doing. It's totally normal. Okay, folks. Well, I've used up my nickel or my quarter in the machine. Thank you so much for joining me. I'm going to bring back the list here. These are some of the topics. If you're on my Facebook Live or YouTube Live, you can see the list. We're going to be talking about egg freezing outcomes, baby sickles. We're going to be talking about access to REIs. We're going to be talking about artificial intelligence. We're going to be talking about the Apple Watch. We're going to be talking about virtual MD, telemedicine. We're going to be talking about PGT, so lots of questions there. We're going to be talking about natural cycle frozen embryo transfers. We're going to be talking about ICSI. We're going to be talking about Zymot. We're going to be talking about letrozole in frozen embryo transfer cycles, letrozole in any cycles. So again, my goal here is to be the educational arm of CNY and to provide you with some data. I'm a data guy. Hopefully it helps you to make good decisions. My goal, of course, is one healthy baby. And quickly, is there any concern about an arcuate uterus? No, that's a normal variant. So good night. It's getting dark here in Colorado. Good night, everybody. Thank you so much for listening in. This is Dr. Magarelli, CNY Fertility, Colorado. Thank you very much for listening in. I hope to see you in Colorado, and thank you for listening. Bye.